Member for New Westminster.
Thank you, Honourable Speaker. Under this BC Liberal government, we've seen hospitals get dirtier and frail seniors get less care. That is the shameful legacy, Honourable Speaker, of Bill 29, tearing up contracts affecting thousands of healthcare workers, which the Supreme Court of Canada found to be illegal. But despite failed cleaning audits and despite continuing outbreaks of C. difficile, it's only BC Liberals who don't seem to understand that cleaning is absolutely critical in healthcare. And it's only BC Liberals who don't seem to understand that continuity of care is absolutely critical to our seniors in residential care. Now another 1,200 healthcare workers at Vancouver Coastal Health and at Laurel Place Care Home in Surrey are about to lose their jobs because of this government's contract flipping. Will the health minister step in and ensure that these healthcare workers do not lose their vital jobs, jobs that are vital to healthcare, to our seniors, and to service in BC hospitals?
Minister of Health.
Thank you, Honourable Speaker. Thank you, Honourable Speaker, and thank you to the member for the question. We do think that it is appropriate when you're looking at housekeeping services, Madam Speaker, after 10 years with one company to go out to the market, because we believe in the principles of the Institute for Healthcare Improvement, which says we should be looking for better patient outcomes, better population health, and value for money. So while we ensure, and health authorities ensure, that people living in residential care are provided with the necessary services and the hours of care they deserve and need, it is appropriate to go out for cleaning services to the market. And in fact, Madam Speaker, in this particular case, 56 more full-time employees will be at work because of this change.
Hear, hear. For New Westminster on a supplemental.
Thank you, Honourable Speaker. Once again, the Health Minister has missed the point. There is ample evidence, if the Minister would study it, that contract flipping is bad for healthcare and it's bad for healthcare workers. And it's time the Minister took a close look at that. Even if these workers are lucky enough to hold on to their jobs, Honourable Speaker, they will have to start all over again in accruing vacation and benefits. It's also bad healthcare policy, Honourable Speaker, that hospitals lose continuity of care and that frail seniors in our care homes have the care providers who are closest to them torn away because of contract flipping, and that's what's happening every month in this province, Honourable Speaker. It's also bad for the mainly women workers, who are already amongst the lowest paid public workers in this province, and it is bad for families when workers have to work more than 2 jobs in order to make ends meet.
Question.
Will the minister stand up today and make a commitment that his government will bring in the strong successorship protections that will be good for healthcare and good for healthcare workers and good for the province of British Columbia?
Minister of Health.
Thank you, Honourable Speaker. And health authorities have contracts in place with their providers that do maintain a high level of quality care and services. And when there are changes, health authorities are given a period of time, Fraser Health in this particular case, 90 days, to look at the change and make sure that any impacts on residents is mitigated. They work with the provider and ensure that the high standard of care for people living in residential care is maintained. In the question, the situation of Vancouver Coastal, Madam Speaker, this is about cleaning services, and I recognize one unionized group will come into the place of another unionized group, and there are changes there, Madam Speaker. The companies and VCH will work to make sure that employment opportunities are offered so that most of the former workers will continue on working in those environments, Madam Speaker. And at the end of the day, a higher level of service, more people working to ensure that our healthcare facilities are maintained at the very highest standards.
Here, here.